Hi, I'm Tony Wood. I'm a third-year hematology oncology fellow here at Tandem here in Orlando, and I'm honored to receive the Robert Korngold Award for Best Clinical Science Article in Cellular Immunotherapy for Transplantation for the year 2022. And I'll be accepting the award on behalf of my mentors, Dr. Michael Jane and Dr. Claude Basile, in the entire Moffitt Cancer Center Cellular Immunotherapy Department. In short, about 20% of cancer patients have chronic kidney disease that would preclude them from clinical trials. And despite them not being in clinical trials, there needs to be a real-world application for these patients, yet we don't have the data to see how safe CAR T is in their setting, nor do we have the data necessarily that says what is the proper fludarabine dosing for these patients, and does fludarabine dosing and the cytoreduction affect outcomes, both renal outcomes and CAR T outcomes. And so that was the purpose of this project. It was a retrospective review of the patients that we had part of our database. In summary, it showed that patients with chronic kidney disease had similar outcomes in their CAR T, regardless of renal dysfunction at baseline. And it also showed that outcomes were similar regardless of fludarabine dosing that had to be modified in relation to the chronic kidney disease. We also were able to describe 2 patients on dialysis and their journey in receiving CAR T-cell therapy so that other institutions can model their chemotherapy dosing and their CAR T-cell administration off of what we did at our institution. The last thing that we showed is that acute kidney injuries were not more commonly associated with patients with chronic kidney disease, although there was a trend towards that, and that patients with higher severities of acute kidney injury had worse clinical outcomes, which is not unsurprising, and most acute kidney injuries were related to cytokine release syndromes, which is also not surprising, but it's the really good data to have down on paper moving forward as more and more patients are going to be receiving CAR T-cell therapy in earlier lines, and as CAR T-cell is being applied towards other malignancies, particularly myeloma, where there's a huge amount of patients with renal dysfunction.